Hi, my name is Bill Quirk, your state legislator, proudly representing Ashland, Castro Valley, Cherryland, Fairview, Hayward Acres, Hayward, San Lorenzo, Sunol, Union City, and Northern Fremont. During Women's History Month every March, I honor exemplary women who are dedicated to making the 20th Assembly District a better place to live and work. I am very proud to say that since being elected in 2012, I have recognized 35 women and the Eden Area League of Women Voters at my annual Women of the Year celebrations. This video will serve to recognize my 2021 Women of the Year. This one is very special to me. It was my honor to select 6 women, all of whom have spent the past year performing as heroes during this unprecedented pandemic. I'm honored to call Dr. Erica Pan my Woman of the Year. She is the first of my 6 honorees to change the fate of the state and nation and save hundreds of thousands of lives. On March 16, 2020, Dr. Pan wisely and courageously joined with 5 other fellow health officers of the Bay Area and announced the lockdown of Alameda County. Dr. Pan and her colleagues made and stuck with this decision and continued to do their jobs despite intense pressure, including death threats. Indeed, many health officers across the country suffered so much from the pressures during the pandemic that they felt the need to resign. Her message to protesters was, "Alameda County, the whole county, is my patient, and I'm trying to make the best decision I can for a large and diverse population with a lot of competing issues and priorities. We're open to ongoing input and feedback, but want it to be in a constructive way." For myself, I have told my constituents repeatedly that they should thank our county government for saving the lives of our family and friends. Inspired by the Bay Area shutdown, a few days later, Governor Newsom made a sudden decision to lock down the state. In my opinion, he would not have done this without the action of the Bay Area health officers. New York State waited. In those few weeks, cases doubled and doubled and doubled again. We could have been New York or New Jersey with bodies in the hospital hallways. After a year of the pandemic, New York and New Jersey still lead the nation in deaths per capita. California, despite its vulnerable population and high population density, is below average in its death rate. Further, many states and the federal government followed the example pioneered by Dr. Pan and her colleagues. Because of her strong leadership, Governor Newsom asked Dr. Pan to be the state health officer and then appointed her the California State Epidemiologist and Deputy Director of the California Department of Public Health, where she continues to serve the citizens of Alameda County as well as the whole state. Dr. Pan was recognized at a virtual event with the Women's Caucus of the California Legislature on March 15, 2021, along with all the other honorees from the California Assembly and Senate. Let's hear it from Dr. Pan.
Hello, I'm Dr. Erica Pan. I'm the state epidemiologist here at the California Department of Public Health. I've been here since last July, where I've been serving to co-lead the COVID-19 response, and I was serving as the state health officer from August through December of 2020. I'm incredibly honored by this acknowledgement of Assemblymember Quirk for Woman of the Year 2020 for my role last March as the Alameda County Health Officer, where I, along with 6 other Bay Area health officers, issued the first stay-at-home orders in the state and the nation. It was a whirlwind day. I remember very well. It was a Sunday where we had our first conference call, realizing how important it would be to take this action, and then worked through the afternoon and evening with our attorneys and other colleagues to issue these orders and also work to make sure that we could think about what were the other essential services that needed to continue in order to make sure people could be fed, stay warm, and have the lights on. It was such an intense experience that it took some time actually for it all to sink in, just the enormity of the impact of what we had done. But I also remember soon after that sitting at a Board of Supervisors meeting and watching residents come forward and talk about the hardships that they were experiencing from businesses being closed and being out of work. Over time, though, we did see other estimates of the impact of this decision, and the Big Cities Health Coalition did an estimate that in Oakland alone, this action prevented over 70,000 hospitalizations and saved over 7,000 lives. It was an incredible privilege to serve Alameda County for over 8 years, and now I've had this incredible opportunity to serve the state of California as well. But it's been a really challenging year for public health officials. We've been at the forefront of making these extremely difficult decisions, trying to balance the protection of our communities from this pandemic, while also acknowledging how hard it is on individuals and businesses to be closed, out of work, and unable to interact socially the way we're built to thrive on as humans. As public health officials, we've been targeted in social media, we've had protests at our homes, and we've borne the brunt of criticisms and frustrations from all levels. In many situations, and perhaps the most challenging, are my colleagues who have not had the support of elected officials to follow the science, data, and public health principles that we think will provide the best way forward in responding to SARS-CoV-2 and this pandemic. At least 190 public health leaders have resigned nationally between March of last year and January of this year. And in California alone, 18 local health officials have resigned. With that in mind, it means so much to have this acknowledgement, and I feel it really ripples to all of my public health colleagues and the teams we work with to know the long and hard hours of this pandemic response over the past 15 months have been noted. I am very grateful for this honor. I and my public health colleagues and our teams cannot thank you enough.
Next, I want to introduce Alexis Jacomi, a frontline hero. Alexis worked as a grocery clerk at a Lucky store in North Fremont. She caught COVID-19. When she recovered, Alexis resumed working 40 hours a week, helping her many regular customers get the food and supplies they needed. And she cared for her parents.
My name is Alexis Jacomi, and I've been working for Lucky Store for about 40 years. I'm very honored that Bill Quirk has recognized me as Woman of the Year. It has been quite a challenge for me working in the grocery store during this pandemic. I take care of my mom as well as my customers and my associates. Again, I am very grateful for being chosen as Woman of the Year.
My next frontline hero is Koya. Like many others, Annie works behind the scenes. She is at Eden Hospital, making sure that both patients and staff are safe and protected during the pandemic. Annie, please tell us a little of what you have been through.
Hi, my name is Koya. I live in the 20th District Assembly for 25 years. I love my district and appreciate the honor Bill Quirk is providing me this year. It's a real privilege. I am an ambassador/dietary aide at Eden Medical Center. I worked at Eden Medical Center for 21 years and have worked at other Sutter Hospital for 10 years. I am a proud union member with SEIU, United Healthcare Workers, and I currently hold an elected position representing many hundreds of hospital workers in the Bay Area as a member of SEIU UHW Executive Board. It touches my heart treating patients during the pandemic. We were asked to communicate with patients through the phone on the nursing unit so we could reduce transmission of the virus. Whether they have COVID-19 or not, inpatients are very fragile. Many of them don't want to eat, but it is very important to their recovery to get their good diet. The hardest part of working in the pandemic and in the hospital was when your own co-workers and yourself, we did not know whether I have the virus or I don't have the virus, but we had to stay home. And then the other coworker that did get the virus, he did not know whether he was going to live or die. So that was really heartbreaking just to hear that one of our dietary person that is not even in the room ended up having the COVID so bad. We are held to the highest standards of our leadership on e-board, and our political leadership is among the roles I've enjoyed before and after winning my executive position. When we are asked to do phone banking, the pleasure comes when it is done and over with, and you have turned a state blue. To have that feeling is you cannot answer it. It took me 3 hours, 13 straight days to sit on the computer to do the phone banking. And you do not know the feeling when they said Georgia had turned blue and Arizona had turned blue. That was the best feeling of, wow, our hard work did pay off. Yes, we needed that change. Yes, we did it. Yes, as a UHW member, I am proud to say we did it.
Arzo Madavi works as an emergency room nurse and has been right in the middle of the COVID-19 crisis. I cannot even begin to imagine what she has seen and heard during the past year. Let us hear from this frontline hero in her own words.
Hi, my name is Arzo Modavi. I would like to thank Assemblymember Bill Quirk for recognizing me as one of his 2020 Women of the Year. I am currently the chair of the Community Services Commission for the City of Hayward. I am also an emergency department nurse of 10 years and have been working on the front lines of the pandemic this past year. Like many other healthcare workers, I sacrificed time with my family. I worried about having proper protective equipment. I risked contracting COVID from those who I cared for, and also stressed about possibly bringing it home to my loved ones. I had chosen my career in nursing so that I could be of service to my community and make a positive impact in whatever small way I could. I never imagined that I would be working during a pandemic, but even so, I consider it a blessing, and I could not imagine doing anything else. I also never imagined that not only would I be taking care of COVID patients in the ER, but I would have the opportunity to work in the COVID vaccine clinic where I could witness people finally seeing the light after such a difficult and at times scary year. I was raised to help others and to always try to do the right thing, regardless of whether there was a reward or recognition for it. After the difficult year that we've had and the sacrifices that we've had to make, I have to say that I am very humbled and grateful for the recognition. As surprised as I was to receive it, it is a reminder for me to continue the work that I do, to strive to be better, and to be grateful in all things.
And now I am honored to introduce Jennifer Bills, another hero. She spent the last year as an elementary resource specialist teacher at Bidwell. With over 31 years of teaching at the Hayward Unified School District, nothing had prepared her for the new phenomena of teaching virtually. Please, Jennifer, tell us what it was like to learn a new way to teach.
Hi, my name is Jennifer Bills, and I've been a special education teacher for Hayward Unified School District for the last 31 years. To Assemblymember Quirk, thank you so much just for the privilege of being mentioned with the incredible women that are my fellow honorees. To the community and to the students of Treeview Elementary School, go Bulldogs. I would like to thank you for all the hard work and dedication that you have put in to this year of school. You have faced challenges that quite honestly may be the most difficult that you will experience in your entire career as a young scholar. The challenges of distance learning have been remarkable, and you have overcome them all. You have overcome Zoom screens when they freeze, when you lose your audio. You've learned how to create a PDF file. You've learned how to take pictures of your work for documentation and upload it to credit. You have been remarkable. To my fellow teachers at Treeview Elementary School, go Bulldogs. I could never have imagined that I would be honoring our community and our school. To Hayward Education Association, to the dedicated, hardworking teachers. This is not an award that I am being recognized for. This is an award that teachers are being recognized for. And it's my distinct pleasure to accept this for all of us. I'm proud of us all, and we shall continue to overcome. Thank you.
I felt it was important to recognize another frontline nurse, one who saw the horrors of the past year up front. Leticia Giukomazi has been a nurse at Washington Hospital for the past 29 years. Leticia spent many days working on the COVID-19 unit, caring for vulnerable patients. At the same time, she fought for safe working conditions. Please, Leticia, tell us about your battles during the past year.
My name is Leticia Giukomazi. I've been a nurse at Washington Hospital for 15 years. I was hired in 1992 and worked my way up from pot washer and porter in dietary to EMT, nursing assistant, and transport, finally to RN in the float pool. I cross-trained in the hospital in many units, including ICU, IMC, telemetry, oncology, all med-surg, emergency, and finally postpartum. It was very challenging, but nothing compared to when our hospital opened up our COVID unit in March 2020. Brave nurses, nursing assistants, respiratory therapists volunteered to work and care for patients diagnosed with SARS-CoV-2. I was chosen to become one of the first COVID resource nurses. I was tasked to keep our staff safe while caring for our patients and tasked to train staff who floated into our area. I want to thank Assemblymember Quirk for choosing me, and I'm very humbled by this honor. I hope to continue to serve my community.
2020 was a year that we will never forget. It is important for me to recognize these 6 extraordinary women. They are examples of the many, many women who are responsible for getting us through these difficult times. Thank you for joining me and for taking some time to learn about my 2021 Women of the Year.